The last cell that I will be going over for ovarian cancer is called stromal tumors. Stromal tumors are a rare class of tumors that develop from connective tissue cells. They are most common with granulosa thincca tumors and Sertoli-Leydig cell tumors. They are considered low-grade tumors, and granulosa cell carcinoma accounts for approximately 2% of all ovarian tumors presented in stage 1. An extremely rare form of ovarian cancer is called small cell carcinoma of the ovary, or SCCO for short. Most of the women who get it are young. It tends to be fast growing. Although the next cancer that I will be providing is not technically an ovarian cancer, it is called primary peritoneal carcinoma, but it's very closely related. When doctors look at it under a microscope, it appears the same as an epithelial ovarian cancer, but during surgery, it happens to be in the fallopian tube, but it is just a theory. As you can see from the picture provided, on one side is a regular ovary, and on the other side is a cancerous ovary. As you can see, there are small tumors and tissue damage all over the cancerous ovary, and it is also extremely enlarged compared to the regular healthy ovary. When you have a cancerous ovary, the cancer can spread to the cervix and other parts and other organs in the body. As you can see by the provided picture, ovarian cancer happens in stages. There are 4 stages in total. Before ovarian cancer, you have healthy ovaries, you can reproduce, and you don't feel any pain. In stage 1, it is the early stage of ovarian cancer, which is rarely detected and can be confined in one or even both ovaries. In stage 2, as you can see here, the cancer has spread to the uterus and to the pelvic region. In stage 3, the cancer has spread to other body parts within the abdomen. You can only see it through a microscope, where cancerous cells can be found in the upper abdomen and the lymph nodes. In stage 4, as you can see, the cancer has spread throughout the body. Cancer is found in the fluid area around the lungs. It can also be found in the lungs, the liver, or the spleen. Ovarian cancer causes and risk factors. Ovarian cancer begins when a cell develops mutations in its DNA. The cell then grows and multiplies quickly, creating a mass tumor, which begins to invade nearby tissues and break off to affect other body parts. The cancerous tumors live while healthy cells die. So, as you can tell, the cancerous cells begin to attack healthy cells, and while the healthy cells are dying, so they cannot defend against the cancerous cells, all the cancerous cells can do is spread and conquer. The risk factors for ovarian cancer are older age, which can occur at you can get ovarian cancer at any age, but the most common in women ages 50 to 60 years of age. You can also get it from inherited gene mutations, from breast cancer gene 1 and 2. which also increase the risk of not only ovarian cancer, but also breast cancer. Family history of ovarian cancer. Two or more close relatives with ovarian cancer means you have an increased risk of ovarian cancer. Estrogen home replacement therapy. It's only increases the risk if there's a long-term use and if you have large doses. One thing that also affects the risk of you getting ovarian cancer is the age when your menstrual cycle first starts and the ending. The beginning of your menstruation at an early age or starting menopause at a later age or both may increase the risk of ovarian cancer. The symptoms of ovarian cancer are abdomen bloating or sweating, quickly feeling full when eating, weight loss, discomfort in the pelvis area, changes in bowel habits, example, constipation, and frequent need to urinate. Treatment options. There are a total of a total of 5 treatment options available. The first is a biopsy, which is a surgery, and it's mainly the first step besides detection. What happens is they take out a piece of the mass to see if it's cancerous. Depending on how much it is spread, in some cases the ovaries, uterus, cervix, or fallopian tubes must be removed. Also, the lymph nodes, the omentum, and also visible cancer is typically removed. If it's in the early stages, like stage 1 or stage 2, your reproductive organs may not be removed. The next step is chemotherapy, which is used to get rid of any cancer cells that are still present in the body. It is usually received through an IV, but works better for ovarian cancer if it's injected into your abdomen. Next, we have radiation. High energy X rays can help kill any cancer cells that are left over in the pelvic area and can also be used to control the symptoms like pain. Targeted therapy are newer medications that find and attack cancer cells while doing little damage to surrounding normal cells. They are able to stop cancer cells from growing, dividing, or fixing themselves. They're usually taken by mouth or given by IV. The last type of therapy is hormone therapy, which is used to treat ovarian stromal tumors, but not epithelial ovarian cancer. Something that has been used as a trial and error is clinical trials. They try new treatments and procedures, and depending on the severity of your ovarian cancer, it may or may not work in your specific case. Thank you for listening to my presentation on ovarian cancer. Have a great rest of your day.